you're going through the ACL recovery process and you've started a squat and it looks like this, where you're shifting a lot of your weight to the uninvolved side versus the surgical side, I'm going to teach you one of my favorite cues that I utilize with our athletes here at the ACL Academy to fix this shift. Before I get further into that video, guys, my name is Dr. Kaan of the ACL Academy, and we put out a new video each and every Monday. If you've been following along and found value out of this page, please subscribe to it. If you got questions, comments, drop them below. And more importantly, if you know of any ACLers, share the wealth as we put out good content each and every week. So today I'm going to talk about, as we start getting into week 4, week 5, 6, as we're walking, we're doing some more what we call closed chain activities, more weight-bearing exercises, and we like to get into a compound movement such as a squat. So a lot of times when athletes begin their squatting, they don't necessarily trust the leg. That leg is weaker, and we tend to get a shift as we're going into that squat. So I'm going to go over a couple things that I like to do as far as progressions go. And then, of course, I'm going to give you my favorite cue that we utilize here to help visualize it and picture it as you're doing the movement itself. A couple things as we want to start transferring weight to, let's say, my surgery side is my left side here. What I like to do before even we get into a squat movement is some gentle weight shifts. So if we start with our feet a little bit wider than shoulder width, what we're going to look to do is just transfer our weight to that involved side. So a lot of times I'll do an exercise where we're transferring weight, but as you can see, when I do that, I bend my knee, so I'm loading my muscles. I'm not keeping my legs nice and stiff and then putting my weight there, because that'll be going through all my joints. I want to load and activate my muscles, so I will bend, hold 2 to 3, 4, 5 seconds even, and then come across the other side. So we can start with some gentle weight shifts to that surgery side so you can build that trust. You could also load that quad. As your athlete gets good with this, or as you get good with this rather, you're going to load. So you can take a dumbbell, you could even take a barbell, kettlebell, and start to put a little bit more weight on that side on a bent knee, so we're transferring further. Another ways that you can challenge this is if you load and then you start moving this uninvolved side. So I could do some taps to the side, I could do some taps backward, all while maintaining a bent knee loaded. And I can transfer a lot of that weight while I challenge a loaded leg, where my muscles are responding, and I'm trusting it in that bent position there. So as that looks better and better, then you'll start transitioning to some squat movements. You could do some squats with chair itself before you go into a deeper position here. So you can start with something higher than a chair as well. But as you get comfortable with something like this, we're just going to tap the chair and then come back up. So I would start with some chair squats, and you could actually do some sit to stands where you don't have to just tap, but as you get more uncomfortable, you can just tap and come back up. If we want to further bias that surgery leg, we'll start from a seated position and we'll go into a little bit of a staggered stance. So I'll put my involved leg forward and I'll keep my surgery leg back, so this way it'll challenge it further and I'll have no choice but to utilize that leg. And as I get comfortable with this, I could push this leg further and further out. The more I push it out, the more it's going to load this leg here. So that's how I would move my progressions, starting with some weight shifts first, then starting with some loaded weight shifts with weight, then some weight shifts with movement. Then I would progress to something maybe higher than a chair, where I'm squatting and tapping the chair height. And as I get comfortable, I'm going to get lower and lower with that depth. And then as I get comfortable with that, I'm going to go into a staggered stance. So I hope that helps that progression. As I feel comfortable with that, then I'll transition to a squat, body weight, or assisted squat first, where we're holding on to something. Then I'll go just to a regular body weight squat and a loaded squat with a dumbbell or kettlebell, holding it goblet style, and then finally a barbell squat. So that's how we progress here at the ACL Academy. And one cue that I talk to all about when I do see this shift, okay? So what we're going to work on here, so if you see my feet and I'm transferring my weight to the uninvolved side, what I want you to think about is starting from your feet, okay? We are going to think about spreading the floor with our feet, which means I'm basically pushing outward. I'm doing a little slight lateral outward push. And when I do that, you will see basically me setting my feet and setting my knees. And I'm going to keep this tension, right? So I'm kind of building up some tension as I sit right in the middle of it. So that'll help me, instead of shifting, right, where I'm going to feel a lot more sided here, I'm going to start by setting both for my feet, spreading the floor, okay, which is going to put some tension in my feet on the floor. Then the tension is going to go up towards my knees, and then I'll generate and keep that tension as I sit right in the middle of the movement. And even as I'm coming up, I'm still thinking about that cue. I'm telling you, if you could just even put that cue in and think about that while you're doing your squat, you're going to even yourself out. Now, does it work with 100% of the cases? No. Sometimes there's a strength issue there. Sometimes there's a confidence issue there. Sometimes there's a mobility issue there. But if you can at least go through the right progressions and use maybe some visual feedback with a mirror, as well as thinking about the movement and feeling the movement in both legs equally, and utilizing that cue that I just taught you, I do think it's going to help tremendously as you start getting back to these more compound lifts, such as a squat. Hope that helps, guys. If you have some questions, drop them below. If not, we are back here next week. This is Dr. Kaan. I drop a video here every single Monday on the channel. If you found value here, please subscribe to it. And more importantly, share with a fellow ACLer that can benefit from these tips and education that we put out weekly. This is Dr. Kaan signing off.